Добрий день всім. Я вітаю.
Hello everyone, this is Olga Atamanova. This is the 99th day of the full-scale invasion of the Russian Federation and also the 9th year of war. Today our team of Ukraine Media Center has prepared the following event. At 12:30 we will hear from Pavlo Kirilenko, the military governor of Donetsk region. We will hear about the situation in the region. At 2:30 we'll be discussing the situation at the front lines, and we will hear from Hanna Mahler, the Deputy Minister of Defense, also Alexei Gromov and Alexei Natochi from the National Guard of Ukraine. And right now we have Mykhailo Radutskyi, the head of the committee at the Parliament of Ukraine on the health of the nation and medical insurance. And we will hear about the condition of healthcare during the war. Please. Hello. Welcome, everyone. Let us discuss the general condition of healthcare and healthcare facilities specifically. We understand that many of them were destroyed during the war. How many of them are there, and what are we doing to make sure that those communities that had their healthcare facilities destroyed to still have access to services? As of now, we see that the Russian occupation troops are destroying not only the infrastructure and military assets, but they also destroy hospitals, maternity hospitals, something that even the Nazis didn't do. And right now there are 727 healthcare facilities damaged, and over 100 of them destroyed totally. As for the pharmacy network, 27 pharmacy outlets were destroyed, almost 400 damaged, and also 11 representatives of the healthcare system died. They were simply killed, and almost 50 were injured. These are the numbers, and I have looked through the history of World War II. Over these 3 or almost 4 months of the war we are having right now, these are the losses incomparable to those that any country had during World War II. This only shows that this war is intended to destroy our nation, because the doctors who are even treating the prisoners of war, they are being killed. Many citizens of our country were forced to leave the country, including healthcare professionals. Do we see the deficit of such professionals right now? Well, because of the IDPs, which are also numerous and which include nurses and doctors. They were temporarily displaced within Ukraine. For instance, the ones from Donetsk, Lugansk, and southern regions of Ukraine, they are adding the capacities in the government-controlled territories. So, as of now, we only see small deficits of healthcare personnel, even smaller than in the pre-war times. And also there are big numbers of international healthcare professionals willing to work here in Ukraine right now, and they don't even want to pay. In the first weeks of the war, the numbers were as high as 5,000 people. So these people are coming, they provide medical operations, and even those without medical education, they can also work for healthcare facilities as primary healthcare professionals. Speaking of the provisions and supplies for the hospitals, do we have any problems with that? In the first 2 weeks, we had a kind of shock in terms of supplies. There were high-quality logistic chains that were disrupted, and as of now, the situation is more or less sustainable. With some items, we see deficits, and the reasons for that is caused by two main factors. First of all, the disruption of logistics chains, because the enemy also attacks the logistics hubs, the railway connections in the west of Ukraine. This is the largest challenge we see, but also we can see something that we are dealing with support of international partners and by means of relocation of Ukrainian medicine producers to the western regions of Ukraine. But the fact is, in the very first months of the war, one of the pharmacy companies had their production facilities and warehouses destroyed in Kyiv region. This was a pharma company. Right now, the company has received a loan from the European Bank of Development, so they are restoring their capacity. Another big company is a company in Kharkiv, Zdorovye. It was manufacturing some of the very necessary medicines, the anesthetics, and of course, this is something in demand right now, but thanks to the efforts of the Ministry of Health and also of the Lviv military administration, part of their production facilities were located somewhere in western Ukraine. I will not give the exact address, of course, but we were able to at least partially or mainly cover this gap as well. And we have different other logistics problems arising daily. With each coming day, we see new problems. For instance, in the first weeks, there were problems with insulin. We don't have them right now. We are getting considerable assistance from the WHO, from the United Nations organizations, from the Red Cross in Ukraine. So wherever the government is unable to procure the medicines, we are getting a humanitarian aid as well. And also there is a priceless contribution of our volunteers. I remember how in this first 2 weeks of war, I was getting phone calls from regular people who had some insulin left at home, and even if they had just 10 packs, they were ready to come and deliver those packs somewhere. So we decided not to buy medicines from the aggressor country and from Belarus as well. Do we have any replacements? Well, that's quite interesting, because we have meetings on a regular basis. The big pharma is lobbying its business heavily. So yesterday, at the meeting that we were having with the Office of the President and the National Security and Defense Council, we had one highly respected person present, and they said, okay, it's not really humane. We are working in Ukraine as a company, but we cannot supply our medicines to Russia. But we answered, okay, but is it humane when Russia using its cruise missiles, when it's killing children, almost 300? Is this humane? And of course, there are manipulations from some respected people. Once again, I'm surprised to see that, but people who represent one highly respected patient organization, Mr. Serdyuk, today he said that okay, this law will prevent Ukrainians from getting certain medicines, etc. He probably haven't read the law yet, but he probably follows the advice of some big pharma companies. So in the law, it is written quite clearly that if these are the medicines with some regional molecules with ontological diseases, orphan diseases, etc. These medicines are not forbidden in Ukraine. They just have to be imported from the European Union or third countries, just not from the Russian Federation. This is the issue that is very much possible to solve. 90% of hospitals, 90% of medicines that can be banned. These are the medicines that can be substituted. These are generic medicines. They are produced everywhere around the world. And it was mentioned today, quite rightly, on social media. A person has mentioned, okay, we will have 30 kinds of diclofenac instead of 90, but that's not a big deal. Everything that depends on Ukraine here, it would look weird if it was just the European Union introducing sanctions and big companies were losing money because of leaving the Russian market. Big pharma is also a big business, but when we are speaking of humane approaches, the most humane approach would be not to kill children. Since the beginning of this full-scale invasion, we do not see COVID-19 on the agenda, but it is still there, right? As of today, I have once joked that Ukraine is the first country in the world that has fully overcome COVID-19, but unfortunately we were attacked by the enemy. Well, unfortunately, that's not true. It's just other things that are important right now. So people are not being tested for preventional reasons. We are noticing right now up to 4,000 cases of coronavirus per week. It is usually Omicron, so it's usually lighter. There is no big need in hospitalization, but again, 1,500 people are hospitalized because of the COVID complications, and there are between 20 and 30,000 active cases right now, according to the Center for Public Health. But I am pleased with the fact that prior to the war, we had 100,000 people vaccinated per week, and right now we have about 50,000 people vaccinated per week. And this contributes to the limitation of the spread of COVID. It is milder, of course, and we are noticing that in Europe, countries like Germany are lifting the COVID limitations. So COVID in and of itself is going to get milder most probably, and will turn into a regular cold in a couple of years maybe. It still exists, but we are not the only country that still have this issue. We have recently heard about the monkeypox, and there are cases of such disease in Europe. What is the situation here? Is there any threat to us, any considerable threat? Well, according to the WHO data, monkeypox will not entail a new pandemic in the world. This is the disease much milder than COVID-19. It is not as easily transmittable, and it's not transmittable fast, because in order to get infected from another person, there needs to be a close contact with a person. It's not like you're on the same bus with someone who has COVID-19 and you get infected. In case of monkeypox, we see that it is less infectious, and WHO believes that such a vaccination campaign as in the case of COVID-19, is not necessary. And this is something, again, we are happy about because, of course, many of Ukrainian citizens are coming back from the European countries which already have cases of monkeypox. Again, this is not the mildest disease, but it is, again, not as lethal as COVID-19, and it's not scary in this regard. So our public health center is ready, and some training is provided to our doctors. There is no specific treatment necessary in this case, and just regular hygiene. This is something that needs to be observed. If you see someone with signs of cold, for instance, please follow social distancing, and also please remember that you need to wash your hands because monkeypox is transferred through close contact. But the threat is not as extensive as in case of COVID. What about the vaccination? The other similar disease vaccination. Well, I asked Mr. Kuzin, and well, I am not an expert in vaccination, so if I share any information, it will be disproven later. Thank you. Thank you for finding time and joining us. This was Mykhailo Radutskyi, and our next briefing is going to take place